Hi guys, welcome to this episode of Case Bites brought to you by Henry Schein. I'm Dr. Michael DeFee, and today we're going to talk about 3D printed surgical guides. So if you don't know me, I'm one of the co-founders of the Mod Institute with Dr. Wiley Renee in Charleston, South Carolina, and we are super passionate about 3D printing and all the ways that it can bring efficiencies to your practice and help to improve both patient care and patient experience in your practice. And so this is our facility in Charleston, South Carolina, where not only do we do education, but we're also actively in practice using the workflows that we're teaching to transform our own patient care. And so many of you have probably heard about 3D printing. Maybe you're 3D printing in your office. Maybe you've got a friend who's 3D printing. Maybe you are just really not sure what 3D printing is and how it actually could work for you. But I'm here to tell you that any procedure that you're doing in your office, whether it's veneers, inlays, onlays, crowns, implant placement, bridges, all on X, can be improved by incorporating 3D printing as part of your workflows. Today, we're going to talk about surgical planning and 3D printing implant surgical guides and how that can really bring efficiencies both from a time and from an accuracy perspective. And so for many of you, maybe you're placing implants now, maybe you're doing guided surgery, but you're having a lab do the guide manufacture, or maybe you are thinking about getting into implant placement, but you're a little nervous or you're not sure how to jump in. I want to tell you that with guided surgery, implant placement is reachable for the majority of general dentists or clinicians at almost any level of practice with a little bit of hard work and a little focus on details. And so I want to talk to you a little bit about the values of what 3D printing surgical guides in office has done for my implant placement practice. From a subjective point of view, I've found that I'm much, much more efficient with my implant placement. And what we've also found is that in larger, well-controlled studies, the literature is also bearing that out. You know, I'm finding that going from placing implants free-handed, where I'm looking at an hour to an hour and a half appointment to place a single unit implant, that I'm now doing those in 30 to 45 minute appointments. And not only is the accuracy much, much better, but also the ability to restore these implants on the back end is much, much easier for me because I've got the implant exactly where I want in a restorative driven place. And so, you know, what we also see in the literature is when you compare implant placement free-handed to pilot drilled, which is basically a guide where you're making your first hole, but then the rest of the actual drilling protocol is done freehand, to fully guided, where you're actually placing the implant through the guide tube in the surgical guide. Fully guided placement not only delivers value from angular deviation improvement, from apical global deviation improvement, to also coronal global deviation improvement. We're finding that all of those areas we're able to deliver a fully guided implant within about a 0.5 millimeter of exactly where we would have planned it, which is much improved over any other type of implant placement workflow. And so do you think that would make an improvement in your implant workflows in your office? I think so, for pretty much everyone. It helps you to avoid issues like this, where you've got angulation issues where you're looking to correct either with an angled screw channel or a cement retained crown, or like this, where it's maybe borderline not even restorable at all, or extremely, extremely difficult to restore. Or this, where maybe you were trying to do an implant bridge, but now the implants are so divergent that it's probably not even possible to do that. That's the value that guided surgery is going to bring to the practice, where you're going to know that your implant is exactly where you want it. And so 3D printing can touch pretty much any part of the implant surgical planning or restorative workflow. We're going to focus a little bit more on the planning today, but I'm going to show you a little bit in the prototyping and how we're using 3D printing there as well. And we're also 3D printing a lot of our final restoratives for our implant crowns as well. So the beauty of doing surgical guide printing is that it works on pretty much any printer that's on the market with FDA validated workflows. They all have surgical guide resins that are approved for those types of printers. But today we're going to focus in a little bit on the Accuretta Soul. It's a printer that we're using in our office and has a lot of benefits. It's very approachable and easy to use. And so this is our patient. So this patient presented to our office. He had been missing that mandibular tooth for a number of years. Finally, he had retired. He had some money and he was ready to put something in that place. As you can see, the maxillary tooth had erupted down into that space, and we ended up needing to crown that because it had a failing amalgam restoration, but also to correct the occlusal plane so that we could design a crown on the implant that was in harmony with the rest of his occlusion. And so we took a CBCT. This was on our Plan Mecca CBCT, and as you can see, space a little tight there. I mean, if I was planning to do this surgery freehand, I definitely would be taking my time and a lot of check x-rays to make sure I'm not encroaching on the mental foramen. Also to make sure that I'm in perfect parallel with the adjacent roots. But with planning the case, it becomes very, very easy. And so I planned the surgical guide for this case in a free software from True Abutment called True Suite. And as you can see, you bring in your DICOM, it gives you a reconstruction. I'm tracing the nerve here to confirm that we're not, going to be encroaching on that. Aligning my intraoral scan so that we're going to be able to design the guide perfectly on top of that. Placing a tooth so that I know that I'm doing a restoratively driven placement where I'm placing the implant itself in a place where it's going to be easy for me to restore once the surgical healing phase is over. Here we are designing our guide outline. I usually like to have cross-arch stability where I'm going to cross the midline. Makes it much easier for me to confirm that the guide's stable when I'm actually doing my drilling protocol. And then here we are printing it. And so this was not a same day type of workflow for me most of the time. So this is about a 40-minute print. I like the Accuretta because it's very efficient and very accurate workflow there. And there's our guard printed, perfectly aligned and set up for our treatment. And so here we are, day of surgery. I placed a Urus 4.5 by 10. And there we are going through our final drill. And this is what I was talking about with a fully guided system. So we're going to place this implant directly through the surgical guide so that we know the placement is exactly where we want it. The beauty of this system is it is also a timed system. So these little notches, we line up with an area on the surgical guide tube so that I know that I have the location of the hex exactly where I want it. Doing a little bit of profiling here to ensure that we have the proper emergence profile. And then for this case, we pre-printed a custom healer on a tie base, and we can do that because the system is timed. And so that's ready to go day of surgery. We place it in. And then, the beauty of this is designed based on my final restorative workflow. So the actual tissue is going to heal around this so that it's perfectly ready when I'm ready to place my final restorative. And so about 3 months later, we ended up doing a tie-based restoration on this for our final restoration because we're helping the patient manage finances a little bit. But really beautiful result. This was a 3D printed also in a sprint ray. Almost a perfect match there. The patient was super, super happy. The ROI for these types of 3D printed surgical guides, for your appointment time for your surgery itself, is usually for me about 45 minutes where I'm in the room, maybe 20 minutes, a lot of times less than that. Costs about $1.50 to print a surgical guide. And then depending on what your placement fee is, anywhere from probably like $1,500 to $2,000, that's a really great service to deliver for your patients, but also an economically valuable procedure to add to your practice as well. If you want to learn a little bit more about these workflows, Dr. August de Oliveira teaches a class for us in the West Coast where we go through a lot of these really detailed that will have you ready to place implants the Monday after class. And once again, thank you for tuning in to this episode of Case Bites brought to you by Henry Schein. I'm Dr. Michael DeFee. My email is dr.defee@themodinstitute.com. This is the QR for my Instagram handle. Would love to hear from you, love to see your cases, love to help you develop the enthusiasm for 3D printing that we have and bring that power to your office.